Hi folks, this is John Adamson, the Rehab and Documentation Guru, and I'm going to start doing some selective readings from Medicare manuals. I'm going to be starting since PDPM is here and it's impacting a lot of therapists. I'm going to start with readings from the RAI Manual. This is basically the Bible for determining how to assess and address patients' needs in the skilled nursing facilities, but also those that are under long-term care. And so this is the Bible, and I'm going to read it in a dramatic flair, but also probably with some commentary, just because I can't help but comment on things. And so we're starting with chapter 1, which is titled The Resident Assessment Instrument, or RAI. So this is the overview, and I'll have some comment on this. The purpose of this manual, and by the way, if you want to look this up for yourself before I get started, go to cms.gov and type in RAI Manual, and make sure you get the one that's October 1st, 2019 effective, because that's the current one, and it's subject to the PDPM changes. So anyway, overview. The purpose of this manual is to offer clear guidance about how to use the resident assessment instrument correctly and effectively to help provide appropriate care. When they say appropriate, they mean medically necessary care. So this is going to have support within the manual for therapy services. Providing care to residents with post-hospital and long-term care needs is complex and challenging work. Well, thank you for providing that little detail. Clinical competence, observational, interviewing, and critical thinking skills, and assessment expertise from all disciplines are required to develop individualized care plans. Notice the word individualized there. So all disciplines, individualized care. The RAI helps nursing home staff in gathering definitive information on a resident's strengths and needs, which must be addressed in an individualized care plan. Listen to that, folks. So it's designed to find out their comprehensive needs, which is going to point to therapy oftentimes, and the care must be individualized. This is all stated by Medicare guidelines. It also assists staff with evaluating goal achievement and revising care plans accordingly by enabling the nursing home to track changes in the resident's status. So this is a tool, folks, and for some of us that were in long-term care SNF management for a while, we used the tracking tools for changes in the MDS assessment to dictate whether or not we should screen a patient for therapy. Okay, let's move on. As the process of problem identification is integrated with sound clinical interventions, the care plan becomes each resident's unique path toward achieving or maintaining his or her highest practical level of well-being. And I talk about this in my course a lot, that is their right that was established by OBRA in 1987. The RAI helps nursing home staff look at residents holistically as individuals for whom quality of life and quality of care are mutually significant and necessary. Interdisciplinary use of the RAI promotes this emphasis on quality of care and quality of life. Nursing homes have found that involving disciplines such as dietary, social work, physical therapy, occupational therapy, speech language pathology, pharmacy, and activities in the RAI process has fostered a more holistic approach to resident care and strengthened team communication. Did you hear that? Therapy is not replaceable. They're integral. This interdisciplinary process also helps to support the spheres of influence on the resident's experience of care, including workplace practices, the nursing home's culture and physical environment, staff satisfaction, clinical and care practice delivery, shared leadership, family and community relations, and federal, state, local government regulations. Persons generally enter a nursing home because of problems with functional status caused by physical deterioration, cognitive decline, the onset or exacerbation of an acute illness or condition, or other related factors. Sometimes, the individual's ability to manage independently has been limited to the extent that skilled nursing, medical treatment, and/or rehabilitation is needed, you can put the word necessary there, for the resident to maintain and/or restore function or to live safely from day to day. While we recognize that there are often unavoidable declines, particularly in the last stages of life, all necessary resources and disciplines must be used to ensure that residents achieve the highest level of functioning possible, quality of care, and maintain their sense of individuality, quality of life. This is true for both long-term residents and residents in a rehabilitative program anticipating return to their previous environment or another environment of their choice. And there you have it, the introduction to the RAI, which clearly stipulates that all care must be individualized, that rehab is an integral part to that we're expected to be involved in the interdisciplinary process for determining the care needs, not dictated to. We are part of the team that decides the individual care plan for your patient. So there you have it, right from Medicare, the RAI Manual. I'll be doing other selective dramatic readings of this manual for you to enlighten yourself as you drive to work or go home at night. Because let's face it, reading this stuff is boring. But anyway, this has been John Adamson, the Rehab and Documentation Guru. Hoping you have a great day. God bless.